The honourable member for Vancouver East.
Mr. Speaker, the Parliamentary Secretary knows that OAS is sustainable, and she also knows, all Canadians know, that the Conservatives hit their plans to cut OAS during the last election, the same thing that they did to health care. Not only did this budget unilaterally cut healthcare transfers, it also cuts Health Canada by over $300 million. All in all, the Conservatives have failed to show leadership on healthcare and have remained silent on critical issues like pharmacare and the accountability of healthcare dollars. Will the Conservatives reverse their reckless cuts to Health Canada?
The Honourable Minister of Health.
Thank you, Mr. Speaker. Mr. Speaker, the opposition claims that health transfers are being cut is absolutely false. Clearly, they are unable to do the math, Mr. Speaker. In fact, the federal transfers for health care will increase faster than provincial spending. Last week's budget confirmed our government will transfer records amount of health transfers to the provinces and territories, climbing to approximately $40 billion by the end of the decade. Thank you, Mr. Speaker.
Member for Vancouver East.
Mr. Speaker, it's the minister's math that is wrong. They're ignoring inflation and population increases. They actually cannot escape. The Prime Minister broke his promise on health care, and the cash-strapped provinces will have to pay the price. Experts, including the Parliamentary Budget Officer, agree that the Conservative formula will cost provinces over $30 billion. There's no getting away from that. So will the government finally listen to Canadians and provinces and reverse their decision to download billions of new costs to the provinces?
The Honourable Minister of Health.
Mr. Speaker, last week's budget was good news for Canada in healthcare, but don't just take my word for it. There are some words of expression about support for the budget from the Mental Health Commission of Canada, RxD, the Rick Hansen Foundation, Canada's Universities, Mood Disorder Society. The list goes on, Mr. Speaker, and yet the NDP members are saying they won't support any of this record level of spending on health care. Thank you, Mr. Speaker.